Thanks for joining me for another tea time this week. Try again. Maybe that's a comfort one. All right, so not sure where to start with this one. I guess let me start from my beginning. And I'll apologize for not being a little more forthcoming with you, but I was kind of trying to hold out hope, and I'll tell you why in a minute. So the day after my surgery, or maybe 2 days after my surgery, I read what said was final on the patient portal. I read the final surgical pathology. And it looked very promising. It looked fabulous. But I was unable to, as you all know, I was unable to see my breast surgeon to talk about the pathology. And then earlier this week, I saw my oncologist who was able to talk to me about the pathology. And let me just tell you right now, the pathology was amazing. Basically, everything that was taken out of my body that was of my making. So any previous breast tissue, all this, everything they took out, there was no cancer, zero. So yay, the neoadjuvant chemotherapy worked and killed the cancer. So happy. But part of the reason that I didn't tell you that the day that I read it with my own eyeballs was that I needed to hear from the doctors that was it, that we did it, and we're clean, good to go. And as you all know, on Monday I saw the oncologist, and I mentioned that the news was good, and it is. That's fabulous. But he also said to me he wanted to talk to the breast surgeon, and they wanted to come to an agreement about whether there was any further consults or treatment that was needed. And I was kind of like, but why? Everything's gone. And he's like, well, and he was a little wiggly. And therefore, I didn't, again, on Monday, share with you the outcome. And my dream was that he was going to talk to the breast surgeon and that he would call me and say, okay, we're good, you're good. You're no evidence of disease, and we're moving on. And then I was going to do a YouTube live or just a video like this, and I was going to have a bell, kind of tying back to that other video, and ring the bell, and I'm done, and wahoo. Deep breath. So I told you yesterday that the breast surgeon's office called me yesterday to reschedule, and I am seeing her on Monday, and I'll get to talk to her more in depth and have a better understanding. And my oncologist called me yesterday, and he said, and I think that all of that has been weighing on me, obviously, and what caused my blah day yesterday, even before I talked to any doctor's offices, because I just felt like the other shoe was going to drop, if that makes any sense. Like it felt like it should be all happy and good. And then I was like, is it? Don't borrow trouble. You know, I'm practicing don't borrow trouble. So in any case, when my oncologist called, he said that he had spoken to the breast surgeon. So obviously she was back in the office. And that they both would like me to go consult with a radiation oncologist to determine if I need to have radiation to the chest wall to make sure, even though all the soft tissue material that was removed from my body was cancer-free, you know, are there still some cells in there that they want to make extra super duper sure that it's gone. It's particularly because this is a recurrence after, I only had a 1% chance of getting it after bilateral mastectomy 9 years ago. So I haven't done a whole lot of research on my own yet to understand about, if this is kind of the regular course or if this is special for me. I feel like the stuff I've looked at so far kind of says when it's a recurrence, they're a little more aggressive in the treatment. So it could just be that. And he said to me, just going to see him doesn't mean you're going to get the radiation. They're just going to look at your information and try and help us make a determination about the best course of action for you. And I know that they're only interested in making sure that I don't travel this path again. So, no malice. But in any case, this is why I have not come right out and told y'all that my pathology was excellent, because I just felt like, is that enough? Am I done? I did the neoadjuvant chemotherapy and I've done the surgery to remove everything that I can. Is that it? I've finished the treatment for this cancer and I have no cancer anymore and I'm done. And inside of me, I was feeling like, can it be that easy? Am I done? I need a doctor to tell me, yes, you are done. And that's what I've been kind of waiting for to tell you. And I guess, unfortunately or fortunately, I'm not quite done. So I think I mentioned in yesterday's video, I'm going to see the breast surgeon on Monday afternoon. Maybe I even mentioned it earlier in this video. My brain's a little... and I've just spoken to the radiation oncology office, and I'll be going to see them on Tuesday afternoon. So I guess sometime next week we'll have a plan. Now the plan might be, yay, I get to ring the bell and I'm done. And that would make me very happy. Assuming that also means that everybody's convinced that I have killed the cancer and there's no need to worry about it anymore. On the flip side, you know, maybe there's another part of this journey. Now, even though I'm kind of a veteran cancer survivor, I've never had to do radiation therapy, so I really don't know anything about it. And maybe what I'll do in the meanwhile, before next week, is do some research on the different types of radiation and understand, you know, their impacts on the body and how they're used and that kind of stuff. That's not going to make a difference so much in what they recommend, but maybe it'll help me understand when I'm talking to them. And that'll help me to accept whatever my next steps in this journey are. Oh, this is kind of a side note, but I wanted to mention it. And I'll see if I can link it. I'm going to try to. It's not my video, but I happened upon a video yesterday from Yarn Lab, which is exactly like it sounds like. She usually does videos on yarn and knitting and crocheting. And even though I'm a very avid crocheter, I hadn't really been wise to her channel before. But I happened upon her because she is also a breast cancer stage 2 survivor, HER2 positive. And so she actually went through this journey several months before me. I think she started in the spring into summer, where I started in the summer. So she was just ahead. And so I caught a couple of her TCHP videos. And she recently did a video strictly about Herceptin and Perjeta, which are the antibodies. And her degrees happen to be in the science field, and she did an excellent job explaining them. So I want to link it here, and just in case you're interested in the science of it. But the thing that was very interesting to me in summary was that the Herceptin targets the HER2 receptors, but HER2 receptors kind of marry one another, and they're the ones that hit that the growth message. In the breast cancer tissue, or in the breast, and actually in your stomach, which is why it's linked to a lot of GI issues. But there's also something called HER3, which is not directly involved in the whole breast cancer thing, but this HER2 gene receptor, you know, when we block the HER2 receptor with the Herceptin, then it goes, hey, there's some HER3. Let me try some of that. And it's able to marry that instead and cause the same ruckus. And so the Perjeta is actually stopping the HER3, which I don't think I had understood before or explained to you, but I thought that was excellent. And her explanation was on point. Very easy to understand. She even had some pictures. So if anyone's interested in that, I wanted to connect you. So if I'm unable to connect it up here in the video, I'll definitely put it down below in the description. So you can check out her video. Like I said, it was quite excellent. She also did a little bit about describing some of her symptoms and how she's doing. Her hair was growing back. She had a cute little pixie. I did comment on her video thanking her for it and telling her how excellent I thought it was. And then asked her at the end, hey, when did your hair start growing back? And I'm already way behind her, but I'm, again, not borrowing trouble. I'm going to wait my 4 months and see what happens. And if I do end up doing radiation, I don't know what impact that will have on all the whole body, including the hair growth, but I guess we'll figure that out. So that's what's been on my mind lately. Sorry about the rambling, but I have been stressing a bit about where this was going. Am I done, or is it still going to keep dragging on? And I just, as fortunate as I am to have caught this so early and been treated and have responded so well to the chemotherapy, I'm still, I don't want to say stressing, but anxious about really putting this behind me and moving on. And one thing I can say from having done this 4 times is being a cancer survivor with the treatment in my back, my rearview mirror, and my behind me is always way better than having it in front of me. And also not fully understanding the plan is a struggle for me as well, as I shared regarding my bald head on Tuesday, and the tea time I had there. So I think those things together it is what it is, right? I think that's about all I had to say today. I was kind of a little disheartened here. I guess, how do I articulate this? And maybe I tuned it out. So maybe it's on me. So I'm going to take some of this on my shoulders because I was very segmented I'm going to do this and this, and then I'll worry about the next things. And maybe they did tell me and I didn't hear it. But in my mind, I thought if the cancer is gone when they do the surgery, if the pathology comes back clean, then we will be done and there won't be any need for any further interventions. So I was surprised and dismayed to hear that I had to get the radiation, or at least the radiation consult. But I guess we'll see where that goes. So if anybody has any insights or thoughts, feel free to share them below. And, I'll just have to take this one like all the other lumps I get. I'll deal with it. It's not the end of the world. And it'll all work out. And I'm happy to say I'm here to tell the tale again, right? So anyway, great news. My pathology came back totally clean. I don't have any cancer detectable in my body. It wasn't seen in my November PET scan, and it wasn't seen in the actual pathology of the tissue that was removed. And I'll mention that the tissue that was removed was some of the tissue that did have cancer in July when I had the biopsy. We took out a fairly significant segment of skin and the breast tissue, and none of my margins were clean. So that means everything around that tissue had cancer in it, and now it doesn't. So that's really, really great news. And it's encouraging to know that the neoadjuvant chemotherapy worked, that all of that torture, in my opinion, torture of the medicine that I affectionately call poison did work. It did kill that cancer. So that is encouraging. And having to keep going on this journey for this cancer, not so encouraging, but we're going to do it. All right. Well, I'll keep you up to date. I'll keep doing my dailies, and I'm sure I'll have a tea time next week. Maybe I'll do tea time on Thursday after I get the feedback from my 2 doctors, or maybe there'll be enough from the breast surgeon to give you a Tuesday tea time. Thanks again for coming along. Tomorrow's going to be a better day. Already today's a better day. I think I feel much better in the blahs sense than yesterday. So tomorrow's going to be a better day. Be well.